Doctor, does IVF failure lead to a feeling of depression or other mental health concerns?
It is common for people to experience a range of emotions during the IVF cycle process, which include excitement, hope, anxiety, and disappointment. It can be especially difficult for individuals to cope with the emotional fallout of an IVF treatment that is not successful. It is normal to feel sad, frustrated, or angry after an IVF treatment that does not result in pregnancy. However, for some people, these emotions may be more intense or persistent and may interfere with their day-to-day life. In these situations, it is possible to develop depression or other mental health conditions as a result of IVF treatment failure. If you are experiencing the feeling of depression or other mental health concerns after an IVF treatment that was not successful, it is important to speak to your healthcare provider or your clinician and be open about the thing so that the healthcare provider can provide support, medication, or provide resources to help you manage your emotions and cope with the challenges of IVF process and failure. Do not hesitate to reach out to support group or speak with friends or family members who can provide emotional support. It's important to remember that IVF is a complex and often unpredictable process, and it's not uncommon for individuals to require multiple cycles of IVF before achieving a pregnancy. It is important to take care of your mental health and seek support if you are struggling to cope with the challenges of fertility treatment. And to add a philosophical note here, in IVF, life is transferred and woman develops an emotional bonding to the embryo that is transferred. And when an IVF cycle fails, it produces menstrual bleeding. For everybody, it's menstrual bleeding, but for the woman who is carrying that embryo, it's loss of life. So the grief responses in IVF are tremendous, and most of the time they're underestimated and understood.